Here is Dr. Alfred Egedovo from the GHC Hospital Health Promotion Initiative. This video is about the classification of obesity as a chronic disease as a topic of ongoing debate within the medical and public health communities.
Some argue that labeling obesity as a chronic disease can help reduce stigma, increase access to treatment, and encourage more comprehensive approaches to prevention and management. Others believe that categorizing obesity as a chronic condition may inadvertently shift responsibility away from individual behavior and towards external factors, such as genetics or environmental influences. One of the main arguments for classifying obesity as a chronic disease is that it can help reduce stigma and promote a more compassionate approach to treatment. By recognizing obesity as a medical condition, individuals may be more likely to seek help from healthcare providers, rather than feeling ashamed or blamed for their weight. Additionally, labeling obesity as a chronic disease can help raise awareness about the complex underlying factors that contribute to obesity, such as genetics, metabolism, and socioeconomic status. Furthermore, defining obesity as a chronic disease can lead to increased access to treatment options and support services for those affected. This can include coverage for obesity-related medications, counseling services, and weight management programs through health insurance plans. By officially recognizing obesity as a chronic condition, healthcare providers may be more incentivized to offer evidence-based treatments and interventions for patients struggling with weight management. On the other hand, some argue against classifying obesity as a chronic disease, citing concerns about individual responsibility and personal agency. Critics suggest that labeling obesity as a chronic condition may undermine the importance of lifestyle choices, such as diet and exercise, in managing weight. By framing obesity as a chronic disease, individuals may be less likely to take ownership of their health behaviors and may rely too heavily on medical interventions to address their weight concerns. There are also concerns about the potential implications of officially designating obesity as a chronic disease on healthcare policies and public perception. Some worry that categorizing obesity as a medical condition could result in increased healthcare costs and resource allocation towards obesity treatment and management. This could potentially strain healthcare systems and divert attention away from other pressing public health issues. In conclusion, the debate surrounding the classification of obesity as a chronic disease is complex and multifaceted. While there are valid arguments on both sides of the issue, ultimately, I believe that recognizing obesity as a chronic condition can help reduce stigma, increase access to treatment, and promote a more holistic approach to weight management. By acknowledging the biological, psychological, and social factors that contribute to obesity, we can better support individuals in their journey towards a healthier weight and overall well-being.